My first birth should have been traumatic. I was a high-risk hospital transfer with a brain-damaged baby. I underwent obstetrical violence. They had hospital mental health professionals checking in on me. One concerned relative even asked if I was... It was bad. And yeah, that experience left me with a lot to process, but weirdly enough, I had no trauma, no postpartum depression. My mental health was fine, given the circumstances. In the United States, we have a birth trauma rate of 45%. So the fact that I was okay is actually shocking. Now, a few years later, I'm a childbirth educator, and I know the reason was because I accidentally had all of these things in place that helped prevent and alleviate any trauma surrounding that birth. And today I want to share those with you because while childbirth can be a very difficult experience, it should never, ever leave you traumatized. By the end of this video, you'll know why birth trauma occurs and how to minimize or prevent it altogether so that you can be fully present as a mother to your newborn. But first, my name is Maria. I'm a Lamaze-Certified Childbirth Educator, a birth doula, and owner of the app Natural Birth by Echo, an evidence-based resource with all of the tips and tricks you need to make your unmedicated birth a positive one. Birth trauma is no joke. It's not just having a bad day, it sets the tone for the rest of your journey as a mother, as well as your baby's start at life. So this is important to talk about. Your baby needs you to be okay. A 2023 meta-analysis found that mothers who experience birth trauma are significantly less likely to develop a strong mother-baby bond. The infants struggle with attachment, which leads to poor emotional regulation and social development down the road. So please, for your baby's sake, do what you need to take care of yourself, your mental health, and give your baby the gift of a good birth experience. Now, this looks different for everyone as our parenting journeys are all so unique, but there are some common denominators, things that you should have in place to protect yourself and ultimately your baby as well. But first, I want to dispel the notion that birth trauma means a painful birth. Birth trauma means a C-section, a baby in the NICU. Not necessarily. A huge study was done, I'll link it below, and it posed the question, how are some women walking away with euphoric birth experiences while others are mentally scarred? They studied thousands of women all over the world and found that a traumatic birth experience has nothing to do with pain or length of labor. What they found was the most important factor was emotional. Did the mother make decisions for her own body, or was somebody else calling the shots? Did she feel supported, or was her birth partner on his phone while she was in labor? Did she feel safe? Heard? Was she treated with respect? These are ultimately the factors that matter most. So for most of us, avoiding birth trauma is really about creating an environment where you are in control. You are supported, you feel safe. So how do we create that in a system that's very protocol-based? It's very structured. First things first, decide what kind of birth you want. To write out a birth plan, dream up your ideal birth scenario, and plan for it. Now, many women avoid doing this because, well, I don't want to be disappointed, so I'm just going to go with the flow, or I don't want to get my hopes up, so I just won't make a plan at all. Look, your plan might change. Mine did. I hated it. But when you decide that plans need to change, and you're the one calling the shots, then the situation is much less likely to be a traumatic one. My first birth plan went through some radical changes. My baby was growth restricted. She was in the NICU. My midwives transferred me out of my lovely birth center. I should have had birth trauma and didn't. Yes, I had some disappointment, but my birth plan was a foundation upon which I made all these other decisions that helped me remain in control and have the best birth possible given the circumstances. So decide what kind of birth you want, make a birth plan, download the app Natural Birth by Echo to learn how to write an effective plan. And if you're asking, well, where do I even start? I don't know anything about birth. Totally fair, which is why your next step is to get solid birth education. Mothers who take a childbirth education course are significantly more likely to report a positive childbirth experience. They are 35% less likely to undergo a C-section. They are less likely to report extreme pain, need an induction, and suffer birth trauma. Now, as for which birth education course to take, because there are a million, the Echo Natural Birth course is the resource I wish I had when I was first pregnant. You will learn how to avoid interventions, how your birth partner can support you, how to naturally naturally lower pain perception in the brain, and of course, how to avoid a traumatic birth. But even more importantly, how to make it a truly positive experience as well. And that is all linked below. Now that you know what kind of birth you want, you're knowledgeable, your next step is to select a good provider. Conduct interviews, ask uncomfortable questions, verify their answers, because I've had obstetricians just lie to my face before. And it's okay to interview as many providers as you need to feel comfortable. They work for you. When I was pregnant with my first baby, I was all excited to go to my very first prenatal appointment. So I get in there, "Hi, I'm Maria, I'm 14 weeks along. No, I don't want an ultrasound because of the DNA damage." And she tells me, "Well, we have to prove that you're 14 weeks. And I explain, "Well, I don't use any kind of contraception. I track my ovulation very closely, so I know exactly when the baby was conceived." And my NFP ladies will get a kick out of this. She then tells me, "Well, you might know when you ovulated, but conception could have happened at any time." And I'm trying not to laugh because I know that sperm doesn't live longer than 5 days. So conception had to have taken place within the time frame that I gave her. I can't not be 14 weeks along. I mean, do you actually not know how conception works, doctor of obstetrics, or are you just trying to gaslight me? I didn't say any of this. I was nice. I was like, okay, thank you, I declined anyways. Either way, there was no second appointment. And I tell you this story to emphasize the importance of finding a good provider. If they gaslight you or they dismiss you in any way during your pregnancy, they are going to do the same during birth when you are vulnerable. Check your Echo app for a complete list of red flags to look out for, questions to see if they're a good fit, and you can always change providers later in your pregnancy. I did that too in my 3rd trimester, and it was the best decision I could have made. Okay, now it's time to gather your birth team. I'm gonna assume that your main birth partner is dad, but sometimes it's your best friend, your mom, your sister. Just make sure it's somebody who supports you and your birthing goals. Your birth partner will make or break your experience. The reason your birth partner is so important is because you are highly vulnerable during labor. You need someone to support you and advocate for you. There was a mom, she wasn't my client, but I heard about this later, and she was laboring in a hospital where the staff were really pushing hard on all of these things that she did not want: Pitocin, continuous fetal monitoring. She's focused on giving birth, right? She's hardly verbal at this point. So she looks to her husband to advocate for her, and he sides with the staff and against her. And in that moment, she felt utterly alone during one of the most intimate moments of her life. And guess what? Her birth went really well, objectively, but for months afterward, she had to work through the trauma of that abandonment, and her marriage suffered for several months after. On the flip side, when you get good birth support, not only are you less likely to experience trauma, but a 2013 study found that you were also 25% less likely to have a C-section. Your labor will be shorter by about an hour. You will have less perceived pain in childbirth, and you're less likely to suffer from postpartum depression, all from having a solid advocate on your team, dad. The onus is on you to go through that childbirth ed class with mom, do the relaxation exercises, find out how she likes to be held and comforted, and of course, learn her birth plan inside and out so you can stand up for her when she needs it most. I also strongly suggest investing in doula support. It can get pricey, but newer doulas who are just starting out will often have discounted rates, making it much more affordable. And as a side note, a newer doula doesn't always mean a less effective doula. As long as you have a good connection with her and she makes you feel safe and she's willing to advocate for you, then it doesn't matter that she's less experienced. That's the doula that you want to have. I would not have survived my first birth without my husband or my doula. It should have been a traumatic experience, like I said, but it ended up being meaningful and empowering. Okay, the next thing you can do for birth trauma prevention happens in the immediate moments after birth, and that is get as much bonding time with your baby as possible as soon as possible. Barring a life-threatening emergency, your baby should go immediately skin to skin with you the second she is born. Not having your baby immediately on your skin is very jarring. It's not natural. Your brain wants you to be close to your baby, so you're wired to be anxious and manic and, dare I say, traumatized when you don't do what you're biologically wired to do. A 2021 2021 meta-analysis showed that skin-to-skin contact reduced symptoms of postpartum depression by 18%, and qualitative data from 2018 showed that mothers who get uninterrupted skin-to-skin feel more empowered after a very difficult birth. And that contact with their newborn is healing, especially if the birth was a tough one. Something else that skin-to-skin helps with is breastfeeding. That closeness with your baby helps you to get to know one another and bond and release the oxytocin necessary for lactation. Now, I won't go into all of the benefits of breastfeeding because we'd be here all day, but one that I will mention is postpartum mental health. Breastfeeding helps you process all of these incredible changes. Mothers who breastfeed are 20% less likely to experience postpartum depression, 14% less likely to have postpartum anxiety. Interestingly, breastfeeding mothers are 10% less likely to exhibit symptoms of birth-related PTSD 2 months postpartum compared to non-breastfeeding mothers. Point is, your body is designed to nourish and nurture your baby. And when you work with the design, it sends you positive feedback in the form of oxytocin, endorphins, prolactin, these hormones that make us feel incredible about ourselves as mothers, which is why it brings so many benefits to our mental health. It's the brain's way of saying, good job, champ, keep it up. Now, I do want to address the moms who do everything right, but their mental health is still struggling. If this is you, mama, know that you are seen and you are not alone. This video is a great starting point, but if your symptoms are severe, please do not hesitate to seek a mental health expert who specializes in birth trauma, or even just speak to your midwife or your doula, because they'll know all of the best people in your area and they'll be able to give you a referral. Okay, I hope you liked this video. If you did, you were gonna love my other stuff, so hit subscribe to get the evidence-based tips you need to have the kind of birth you want, and I will see you next time.